Hello, my name is Crystal Pirie. I'm the Senior Director, Indigenous Collaboration at the Thunder Bay Regional Health Sciences Center. I am a member of Nedamizagmig and Nishnabeg, formerly known as Pic-Mobert First Nation. I've been here at the hospital for just almost 2 years, and I work closely with the Indigenous navigators, as well as providing services for the senior management team and supportive services for programs and operations within the hospital. My message for everyone is to take advantage of the opportunities to learn about the Indigenous culture, the diversity within Indigenous culture, and enjoy the teachings and the wonderful messages that will be available virtually on June 21st as we all celebrate National Indigenous Day throughout our country. Thank you.
Hello, happy Aboriginal Day. And my name is Susan Anderson, and I work at the Reno Department. And I've been there for a few years, and I work as an Indigenous navigator. And I will briefly talk about my role. And this Indigenous navigator position was put in place because of for First Nations people, for us to act as a bridge between the patient and the community and the healthcare system. The Indigenous navigator is a source of support, direction, information, and advocacy for patients. Also working with primary caregivers to provide culturally sensitive healthcare. The navigator position arose out of a need for understanding and respecting social and cultural differences. This position has been in place for a few years now, and there have been positive outcomes. Patients have more successfully returned to home communities with more comprehensive care plans. Patients are able to follow up or get referrals in the hospital, clinics, specialists, and community agencies. And healthcare teams have been instrumental to higher success. Services include attending appointments, continued contact during hospital stays, coordinating referrals and linkages to community resources, interpretation to ensure patients fully understand the care given and the healthcare providers understand the needs of the patient. And what Aboriginal Indigenous Day means to me. It is called National Indigenous Peoples Day. And this date was chosen because it's the summer solstice for the Ojibwe and all groups across Turtle Island. This day is a start of gathering and ceremony. Due to injustices to our Indigenous peoples, many have had their cultural and spiritual practices lost and interrupted. This day honors that heritage, our many and diverse cultures, and the contributions of Indigenous people to Canada. Thank you.
Hello, my name is Leona Masakayash. I am from Slate Falls First Nation, that's north of Sulakaut. I work in the emergency department as the Indigenous patient navigator. My role as the Indigenous navigator is to advocate, navigate, and translate. I work with the First Nations people that come to our department, also with the Inuit and the Métis. I support people of all ages. If you must come to the Emerge department, please ask for the Indigenous navigator. The nurses know how to find me. Happy Anishinaabe Gijigan to all, and be safe. Miigwech.
My name is Michael Robinson. I'm the spiritual care provider here at the Thunder Bay Regional Health Sciences Center. My role is to address the spiritual needs of the Indigenous population that we have here in the hospital, our Indigenous patients, their families, and their loved ones when they come through the hospital, and also to provide services for also our non-Indigenous patients as well in the hospital. So my role is very diverse here in the hospital. And for me, this upcoming National Aboriginal Day, I look at a bigger picture when I think of this celebration. I appreciate that the country acknowledges the Indigenous people. I appreciate that it's a celebration of togetherness, of oneness. And I also look at the picture that it's not only a celebration of Indigenous people, but it's a celebration of what we have on our medicine wheel. So a celebration of all races, a celebration of unity, a celebration of our country, and one day being united, where racism and discrimination will be, hopefully, one day a thing of the past. But also on the other side of the coin, I also look at when we have celebrations of other cultures in the world. We have Black History Month, which is an entire month of understanding Black culture, and we have all these other celebrations that are going on. And Indigenous people, we've been fighting the same struggles and the same disparities for decades now, and as my elder put it, we're only given one day. So that's the other side of the coin that I still look at, is that we should actually have an Indigenous Cultural Awareness Month or an Awareness Week. I think that would be a step in the right direction to following what we do here at the hospital, especially being inclusive of all cultures and being diverse to all our needs of the hospital and all races and all people. And the spiritual needs, I look forward to a day when if we do ever have a fire pit here or a sacred fire pit, we can have Aboriginal Day and start off with a sacred fire early in the morning and have a day's worth of celebrations here and education for people that want to be more aware of who we are and the struggles that we've gone through and the advances that we made and the changes that the hospital made to destroy discrimination and to help eliminate the stigmas that unfortunately still exist in our society. And I think that's going to be a beautiful day when our hospital can celebrate in unity with all people.
Happy Indigenous Peoples' Day.